Hello and welcome to StarTimes Daily COVID-19 report. This program is trying to help you understand the development and spread of the coronavirus and provide you with some valuable knowledge on how to avoid COVID-19 infection. I am Maxim Bertrand. Now let's look at the numbers. As of March 24th, 2020, there are more than 370,000 infections confirmed worldwide. According to data from the World Hour Meter Info, by 12 a.m. GMT on 24th March 2020, there are 378,560 confirmed cases and 16,495 deaths globally. So far, there are 195 countries and regions that has reported COVID-19 cases. All across Europe, countries are imposing increasingly strict measures to restrict people movement. Italy reports 4,789 new cases, driving the total figure to 63,927, among which 7,432 people has recovered. Italy has closed non-essential businesses to try to control the outbreak, and outside help is on the way. Doctors from Cuba and China, as well as medical supplies from Russia, have been dispatched to help support the overflowing hospitals. The US reports 9,971 new cases, totally 43,537. The good news is there are 295 people who has recovered. Officials in New York, Washington, and California states say that there is an urgent need for medical supplies because of the COVID-19 pandemic, and they're calling the federal administration to nationalize the effort to acquire more necessary items. Spain faces the second highest infection cases in Europe. Testing kits have been issued for frontline hospital staff, older people in care homes, and those most affected by the virus. Around 12% of those diagnosed with coronavirus are health workers. The coronavirus pandemic has now spread to nearly every country in the world and is quickly picking up space, with 195 countries and regions globally now infected. Up next, we have a report from the World Health Organization. The pandemic of disease caused by coronavirus is accelerating, the World Health Organization said on Monday, with more than 370,000 cases reported from nearly 195 countries and regions worldwide. It took 67 days for the first reported case of COVID-19 to reach 100,000 cases, 11 days for the second 100,000, and just 4 days for the third 100,000. The number of officially recorded cases is believed to represent only a fraction of the true number of infections, with many countries only testing the most severe cases in need of hospitalization. The director of the WHO said that it was still possible to change the trajectory. He called for global political commitment to change the trajectory of the pandemic, urging countries to take much more aggressive defense and attacking measures. The coronavirus epidemic is getting worse in Spain. The Spanish government is turning a conference hall into an infectious disease hospital. As of March 24th, a total of 300 coronavirus patients were moved to an infectious disease hospital set up at Madrid Conference Center with 5,500 hospital beds, including 500 ICU beds. Soldiers helped move 200 patients from local hospitals to the sprawling IFEMA Conference Center, where 1,300 hospital beds have so far been set up, the regional government of Madrid said in a statement. The authorities have already converted local hotels into treatment centers for patients with mild symptoms. Madrid, the capital city of Spain, is the worst hit region. Prime Minister Pedro Sanchez has warned that Spain's outbreak is already among the harshest in the world and will continue to rise. As of March 24th, Spain recorded 6,368 more cases in 24 hours, rising the total to 35,136, the second highest in Europe after Italy. With the improvement of the coronavirus outbreak in China, Wuhan City in Hubei province has changed from hold down the suspended to restart the recovery. With the improvement of the situation, Wuhan, Hubei gradually restores its urban functions. On March 22nd, all 27 temperature checking points around the Yangtze River Bridges area and nearly 80 temperature detection points in the Wuhan city center has been removed. At 7:30 a.m. on the 23rd, more than 2,000 Dongfang Honda employees living in the Fenghua Wei community of Wuhan had been transferred to the plant by taking 50 buses. The plant is restarting the production line. This is the shuttle bus service provided by the Wuhan Public Transport Group to help entrepreneurs rumble back to business. At present, 912 trains have been dispatched and more than 10,000 people have been transported. At the same time, more than 101 buses routes are back in operation. All passengers need to be scanned before getting aboard the buses. At various subway stations, the staff is undergoing comprehensive disinfection. Maintenance work has already begun. Residents of epidemic-free communities can go to the store to buy daily necessities and fresh fruits and vegetables. At present, the supply of Wuhan market is stable, and the major daily necessities of the residents are sufficient. The government has strong confidence to guarantee the basic living needs of citizens. Okay, so now let's check the situation in Africa. Until the 23rd of March, coronavirus has now been confirmed in 43 out of the 54 African countries, with 1,396 confirmed cases on the continent. Governments of the African countries have announced latest measures and policies to curb the spread of coronavirus. WHO Africa has issued an update of COVID-19 on the continent. The organization reports that there is now a total of 1,396 confirmed cases in 43 African countries, with 16 cases confirmed in Kenya. 27 cases, including 2 deaths, have also been confirmed in Ghana. South Africa has seen a massive jump in confirmed coronavirus cases in the country, with the total now at 402. The South African Ministry of Health issued a statement pointing out that the new number of diagnosed cases in South Africa for the first time exceeded 100 per day, reaching 128 cases. 2 confirmed cases were reported for the first time in the Northern Cape Province. The African Center of Disease Control and Prevention predicts that a large-scale outbreak will occur in Africa in the next stage. In order to strengthen the prevention and control of the epidemic, many governments have upgraded their precautionary measures, including closing ports, forcing quarantine, and launching social distancing policies. In order to stop outbreaks in other areas, South Africa, the powerhouse of sub-Saharan region, announced on March 15th that it has entered a state of disaster and launched a crisis management mechanism. On 23rd March, Health Minister of Zimbabwe, Moyo, announced on state television that the country had the first case of death from COVID-19. The male, called Zororo Makamba, is the first death in Zimbabwe from the virus. On March 20th, he was admitted to the hospital in the capital Harare after showing flu-like symptoms, the health minister said in a statement. On 21st March, he was diagnosed with COVID-19. Makamba got infected while he was in New York in the US. Authorities are now tracing those who came into contact with him. Up till now, Zimbabwe has reported 2 confirmed cases. Another patient is currently self-isolating at home. He has mild symptoms and is gradually recovering. The president of Zimbabwe has urged the nation to take precaution against COVID-19 after Zimbabwe confirmed its first case late last week. The president of Zimbabwe has still announced the immediate action of closing all borders except for returning residents and cargo. He also emphasized that all gatherings of over 50 people will be banned. Bars, nightclubs, gyms, and swimming pools will be closed in an effort to contain the spread of coronavirus. Welcome to Staying Safe. Coming up next, we'll give you some knowledge and guidelines to help you stay safe from coronavirus. Sometimes we need to go out, for example, to do some shopping, to meet friends, but how can you avoid being infected? Here are some tips to avoid infections from coronavirus.
How can I prevent infection outside? When traveling distances, prioritize walking, bicycling, motorcycling, or taking your personal car. When taking public transportation, be sure to wear a mask. When in the workplace, keep a distance of 1.5 meters from anybody you must speak with. Avoid any meetings or gatherings in small, confined spaces. When eating at the same time as others, remember to keep your distance. Don't talk while eating. When shopping at places like supermarkets and shopping malls, try to go when less people are likely to be out. Try to avoid getting close to others. There will be more time for closeness in the future.
Well, that is all for this episode of StarTimes COVID-19 update. But be sure to join us tomorrow. We'll give you more information in terms of numbers and what governments are doing to help protect their citizens. My name is Maxim Bertrand, and see you tomorrow. Until then, stay safe.